all, I would like to congratulate your presentation and also for considering the baby. Okay. Now, your diagnosis is a typical preeclampsia. Okay, that's the main cause. Okay. Now, as future physicians, how would you now detect? Okay, a typical preeclampsia, so that we can prevent this deaths.
Actually, sir, the most recent studies on the typical preeclampsia, or the latest, like the oldest studies on the typical preeclampsia are actually the 20,000s pa po. So this is a typically new phenomenon. So what it's trying to, because the term traditional preeclampsia they use is usually what we know from books, right? From Williams. It's proteinuria plus hypertension. And there's a criteria, it has to be 4 hours apart, less than 7 days apart. Actually, there's no standard to diagnosing a typical preeclampsia right now. What's it saying is that there are other signs that may herald the coming of an eclampsia, for example. Because the traditional way you look at preeclampsia, eclampsia, and health is that this is a spectrum. Like, preeclampsia will predispose you to eclampsia and it will predispose you to health. It's like an end-stage thing, right? But then, these newer studies tell us that, you should not disregard proteinuria without hypertension. So I guess as future physicians, you should not disregard symptoms such as proteinuria. Or the case reports we see, actually headache was actually the first sign. Or fetal distress was the first sign. So basically it tells us to look at the overall picture of the patient rather than solely relying on clinical practice guidelines or clinical criteria to judge our patients. It's a balance of both, of looking at the clinical picture, just reading your books and looking at criteria.
So, how can you say, how did you narrow down on a typical preeclampsia as the cause of your abruptio?
Ma'am, a lot of abruptios actually occur spontaneously. We're just saying that it could have predisposed our patient to an abruptio. We're calling a typical preeclampsia based on what we said, that our patient had proteinuria. But then when we look, this is what our thought process po, no? Their patient had proteinuria. What could explain this? It could be an intrinsic kidney problem because the patient had solitary kidney. But we also looked at the setting of the patient. A patient was a pregnant patient, and we looked at other laboratory parameters. So we looked at hypertension, and it said that there are cases of masked hypertension with abruptio. It's very common, it's around 33% po. So they said that if your patient is normotensive with proteinuria, the recent studies do not suggest not disregarding it as not preeclampsia. So we looked at other parameters. They actually looked at biochemical parameters like placental growth factor. But then there are other studies that advocate the use of hemoconcentration, looking at hemoconcentration. And there's also a good correlation with the number of, which is increase in our patient, nucleated RBCs. So it's at 200 in the patient. The cutoff is around 113 po, for normal. So we have 200 nucleated RBCs in maternal blood post-transfusion. And then there's also marginal concentration, proteinuria, and the masked hypertension po. So we called it an atypical preeclampsia, which could be a risk factor of an
Masked
abruptio.
hypertension. This patient had regular prenatal checkups at the lying-in. She didn't have any sign of hypertension. Yes, it could be that the patient had a normal BP because she is internally hemorrhaging, but the PE showed that she's actually an OB normal case. She came in at 5 p.m. She had the regular labor pattern, and she delivered midnight. How can you connect those things?
Based on the definition of preeclampsia po, it can occur from 20 weeks AOG to 12 weeks
Yes, I know.
postpartum. Yes po, so okay, everyone. But it can happen at any point po. That's our first argument on that. But second
But
is
the
that's why it's
patient
called-
didn't have any sign of an elevated BP.
That's why po it's called atypical preeclampsia, because it doesn't require hypertension. Proteinuria alone may be a sign. Hypertension can occur after eclampsia even, or after elevated liver enzymes.
Just to follow up on that, how fast would you develop abruptio when you have a subclinical preeclampsia?
Actually, sir, we have no studies on that po. Given that it's also atypical preeclampsia,
Because,
sir.
as you have mentioned, the abruptio is just an effect of the preeclampsia. And you're claiming
Not,
that the
sir.
preeclampsia is not that
Sir,
typical. And
it's-
it's quite difficult to correlate that you have just diagnosed preeclampsia now and suddenly the patient would have abruptio.
Sir, actually, there are no studies that would tell you that preeclampsia will cause abruptio. It's a risk factor thing. If you look at statistics po, they tell you that there is an increased risk, but they will never tell you that there is causation because you cannot do a randomized clinical trial.
But the question is, how fast do you expect it to happen? The patient had not manifested preeclampsia in the prior history.
Yes, sir. Sir, but an abruptio can also occur spontaneously. So we're just saying that it could have occurred spontaneously, but the presence of preeclampsia is an undisputed risk factor for abruptio. So whether or not a typical preeclampsia is there, abruptio can still happen.